Hello and welcome to Health Options with me, Rabi, Abdallah. Herd immunity refers to the number of people in a population that must develop immunity against the disease, and the coronavirus pandemic is the focus in this regard. What happens to Nigerians as the lockdown is gradually eased? Lockdown, as you're aware, aims at slowing down the transmission of the disease and flattening the curve. What are the different ways or modalities that must be put in place to attain herd immunity? Although vaccination readily comes to mind, the challenges of developing vaccines and possibility of SARS-CoV-2 mutation presents additional challenges. According to experts, it will take at least 12 months or more to develop a vaccine. The country may not be able to continue with lockdown for longer periods because of the impact on the nation's economy. The question then is, what is the way out of COVID-19? Although the current measures of preventing the COVID-19, talking about hand wash hygiene and the other safety measures of social and physical distancing and the use of face masks are considered to be quite effective, some health watchers are of the opinion that the ultimate way out is attaining herd immunity or active immunomodulation. How do we get our immune system up-regulated to combat COVID-19 and other diseases? The term second wave has found its way into the discourse around COVID-19. But how well do you understand what it means in the face of the coronavirus pandemic? We will discuss that and what other countries, for example, Germany, Sweden, and others are doing to get out of the COVID-19 situation. Insights into these and more on this episode of Health Options, the program that not only tracks government policies on health, but helps you to make informed choices about your health. Many thanks for joining us. This is Health Options, and we're looking at herd immunity and second wave, talking about the coronavirus pandemic. And joining me in the studio to take us through the discussion is an integrative medicine expert, Dr. John Tor Abide. Thank you for joining us on Health Options, Dr. Tor Abide.
My pleasure, Rabi. Always nice to be with you.
Okay, we know that we eventually get to total ease of maybe the lockdown and all of that, but that entails individual and collective, survival, and that's where the issue of herd immunity comes in now. What exactly are we referring to at the mention of herd immunity?
Well, thank you very much, Rabi. Let me be fair here. With regards to your introduction, if I were to be your teacher, I will actually give you an A. You did an excellent job.
Oh, thank you. I take that as a compliment.
Okay, you're welcome. Yeah. Let's really go straight to it. Herd immunity. Herd immunity, as you said, is the ultimate of us getting out of this problem, any disease problem outbreak. So let's look at the concept of, herd immunity. Take a community A and community B. Community A, for simplicity, and B have 4 people each as a community. Now, community A, the population, none of these 4 people have immunity against a disease. In this case, COVID-19. So they don't have any immunity. So when the virus comes in and attacks the first person, the person comes down with the disease and he will transmit it to the second person. The second will transmit to the third will transmit to the fourth. All of them would get the disease because they have no immunity. However, in community B, on the other hand, take that. The second person, because he had suffered from the disease previously and developed immunity, if the virus comes in and hits the first person will come down with the disease, but he will not affect transmit the disease to the second person.
That the one who had suffered it.
Yes, has suffered it and developed immunity against the disease.
Okay.
So you can see that the second person now cannot transmit to the third and to the fourth. So you see that population is covered. So we say that this community has herd immunity against that disease. In this case, COVID-19.
Okay.
But let's really go further, because it is very important for us to understand. There is an epidemiological term, they call it R0, and every disease has what you call the R0. In this case, COVID-19, the R0 is actually 2 or 3. What do I mean by R0? R0 is the degree of infectability, just like I described. That means that if one person in the community is affected with COVID-19 that doesn't have a herd immunity, he is capable of affecting 2 or 3 people. So we say that the R0 for COVID-19 is 2 or 3. Now, since we're talking about herd immunity, the herd immunity has a formula. Thus, we say the herd immunity equals to R0 minus 1 over the R0. That, for example, if you are taking 2, it means that 2 minus 1 over 2, that is half. So we say that the herd immunity that must be attained in the population is 50%, because half is 50%. If it is 3, the herd immunity has to be 67%. Now, look at it this way. Let's be practical. Taking the population of Nigeria, which is 200 million people, it means that the herd immunity that must be attained for COVID-19, if we are going with 2, will be what? 100 million people. You know what that numbers mean. On the other hand, if you're looking at 3, it's about 67%. Now, that's with this background, we know that herd immunity for COVID-19, it means that the population of Nigeria that must be immune against the disease, if we're looking at 2, must be 50%. If we're looking at 3, it must be 67%.
How do we go about achieving that in the absence of vaccine?
Fantastic. This is what you're going to do. You can take the virus and infect people so that they can develop immunity. That is one way of doing it.
That's
that is rapid spread.
For
yes.
COVID-19?
Yes, rapid spread of the disease. Now, if you take that approach, it is too risky. Why is it too risky? You see that for you to allow the 50% of the population to come down with the disease, in case of Nigeria, you're talking about 100 million. Can you imagine what it means by having 100 million, and then for you to attain that 100 million, which is 50% of the herd immunity, it will take up to 1 year, because the disease doubles almost every 3 to 4 days. So you can do that. That is the rapid infection of people with the virus, so that they come down with this.
Which is the best option outside vaccination?
Well, outside vaccination is the best. If you just allow me, I'm going to come to you had asked me that how do we do to attain, herd immunity?
Yes.
And I said the one way is to allow natural spread of the disease. But you can't afford to do this. By the time you do that, you are having to deal with 14% of the population. You have to give them oxygen.
Will become overwhelmed.
It will become overwhelmed. Your health care system will crash. The frontline workers will also come down with the disease. You will be in a total mess. So we cannot afford to do that. So the second one is to allow to lock down and slow down the spread of the disease. Actually, that is what lockdown achieves. It doesn't mean that you no longer have the transmission going on, but you are slowing down the transmission of the disease, so that it will give you the time. You can buy time to talk about isolation centers, increase your number of diagnostic centers, increase your number of testing, so that they train your the personnel. So the lockdown, basically what lockdown does is buys you time to do this. But see, the process of going through this is too much, because of what? We tried it here. and we're still in it. You know that for almost 2 months now we've been locked down. The impact on the economy is too much. You cannot afford to just to lock down indefinitely.
But that's why it's gradually being eased.
It's gradually being eased, but how long do you ease? And this, because after the lockdown now comes the problem of what we talk about, second wave. Remember, lockdown, you've just confined people, you confined movement, they are no longer moving, but it doesn't mean that the disease is no longer moving, only it is moving at a slower rate. And it is also allowing the body to develop, immune system, so that once those who are affected can handle it better. But lockdown is also not the ultimate, solution. So, because of the economic impact of the long term. Now, vaccination, which you rightly covered in your introduction. Fantastic. Vaccination is the ultimate way which we can look at, because with vaccination you can bring in vaccination here and then vaccinate half of the population, and once half of the population develops immunity, you have achieved your herd immunity against the disease. However, as you rightly mentioned, there are challenges with vaccines. Have we ever developed an effective vaccine against viral diseases? We're still struggling with that of HIV. Up till now, they've not succeeded because of the problem of mutation, which you excellently elaborated on. What are you going to do? The best thing to do, that's what after vaccination. So let me take you to where you want to go, is what we call palliative care.
And what does that entail?
Palliative care entails the use of nutrients so that you can build the body, boost the body immune system. Once the body immune system is already boosted, remember, even in herd immunity, what you are trying to achieve is to get, the body have immunity against the disease. Although that of palliatives or use of micronutrients would lead to building the body's immune system. Thus, even if you do other precautionary and sanitary measures that you rightly, pointed out, but unfortunately the individual ends up having the virus, the body's immune system will be able to fight and defend him. So he will not go into those critical stages of requiring them to go on ventilator. You can do preventive this. So, what are some of the things that are used? Globally now, chloroquine is being used. Although WHO just came on 2 days ago, that is a controversial one. But I'm telling you, moms, I'm glad that some of these countries have come out to tell WHO in her face that no, we have used this, we know the benefit of it on our people. You can't stop us. So I'm talking about hydrochloroquine here.
But Nigeria is not towing that line.
Why?
Nigeria, it's aligned with countries that want to stop the use of chloroquine.
Well, they got to think twice. They got to think twice, because let me tell you, what are the reasons, for stopping it? Is it because WHO has told you that you should stop it?
Yeah, because it affects some of the patients with cardiovascular.
There is no doubt about that. It does, and that's why it is very important that it should be used rightly. There are different stages of using, hydrochloroquine. You can use, and that's why the proper dosage has to come in. The dosage that you use for prevention is different from the one that you use in early onset of the disease or the middle part of the disease and the severe stage of the disease. Also, hydrochloroquine has its own contraindications. You know that there are cases where you should not, use it. And then, so we talk about hydrochloroquine, then we talk about azithromycin, which is an antibiotic. These have been used in combination, even in that, in the United States. There are doctors who are using this, and you have publications that have shown the beneficial of this. And here again, let me not be quoted, I'm saying that things like that should be used, but should be used under the guidance and supervision of a physician that knows the right dose, what we call the prophylactic or preventive dose from the therapeutic or treatment, dose.
Herd immunity.
Okay.
In the absence of vaccination,
yes.
What do we do?
But in addition to these various ways that we have discussed, that you can work towards building your the immune system.
Herd immunity.
Towards building your herd immunity. There are other modalities that are being used, especially in places like the United States. I don't know about us here, but because once an individual recovers and attains immunity, you can collect his own plasma. And then the plasma contains the antibodies against the disease, the immunoglobulins, immunoglobulin A, immunoglobulin G in particular, and then M. So that plasma can be given to even healthy people so that they can develop immunity against the disease. This is what we call use of convalescent plasma. This is a medical approach that it is being used, and can be possibly you also considered.
I think that was done with our index case, the Italian, after his recovery.
Oh,
yeah, I think that was done.
Okay,
But how long does that confer immunity on people?
Good. Because you see, as I've already said, because this is due to antibodies, and then the immunoglobulins, they actually have a short life. They last about 3 to 6 months. That, in other words, the immunity that they can confer onto you is about 3 to 6 months. However, half bread is actually better than none.
Mm-hmm. So if you support that with immune boosting supplements,
and the ones
nutrition.
the list, and nutrition is the one that I've listed. And coming about nutrition or supplement, those ones that I've listed, it is common amongst us here. We find these things in oral form or tablet forms. We are advocating the use of injectables because in disease state, the levels of these micronutrients has actually gone down so much, depleted so much. So the fastest way to actually boost the level is through injectables. So we have the injectables, like we have vitamin C injectable forms, we have vitamin D injectable forms, we even have zinc in injectable forms. And we give this in high doses so that it will compensate for the lower, loss that you had and bring you up to that physiologic or pharmacokinetic level quickly.
Okay, there's been one issue that's cropping up now, as we gradually ease the lockdown, is second wave. I know that Nigeria is not there yet because as I was made to understand that we have not even attained the peak here in the country, not to talk of flattening the curve, then talking about second wave. What is the second wave all about?
You see, second wave simply means when you lift the lockdown, people are now free, people are now relaxed. There is both intra and inter-community interactions. People start mixing. Now, when you start mixing, you don't know whether the other community that you are visiting is free or not. You came from a lockdown that prevented you from interacting and coming down with disease.
No, we
and
still
now,
have interstate lockdown.
What?
Interstate travels have not been.
We still have that.
Yes,
but I'm talking about, even lockdown, let's talk about what I call intra-community interactions. Okay. That is within the same community, like Abuja community, I call it intra-community. That is within the community interaction. I'm not talking of inter-community interactions. So even that, within that, for example, during the lockdown, people in Galadimawa were not allowed even to go to places like, Gwarimpa. So, but you leave that, people start interaction again. The guy from Galadimawa that was actually, free, now moves and then encounters maybe a new guy who moved into Gwarimpa. He will be, infected. So when this occurs, that is what you call second wave. And there are so many compounding factors because during the second wave, you see that another interesting thing is that the guy in Galadimawa, maybe he just got the disease 2 days to the lifting up the lockdown. There is no way of telling that he has a disease because the incubation period for the disease is about 7 to 21 days. Actually, the mean time is actually 5 and a half days. So within that time, now he moves. He has not started showing the signs yet or the symptoms yet. Now he moves into a community that it is actually healthy, he will infect that community. So this is what we call the second wave. Also, the problem of asymptomatic. It could be that patients in community B were actually having the disease, but they were asymptomatic. Having the virus, but they were asymptomatic. Thanks for that correction, because it is very important. There is a difference between infection and then disease. During infection, that is why when you have viral replication, when the virus replicates to a certain level and then starts causing damage, that is when you have the disease. So the virus but is not showing the symptoms. When he moves into another community, now he because of stress or other factors, he is a potential source of infection again. And when this happens, then you see the number of cases, new cases, start surging up. So we say there is a second wave. Once a disease comes into a community, there is what we call the Gaussian normal curve. It will go up like this to the peak and then goes down. So, and that is the concept of herd immunity. We're saying if it is allowed to go up and attain that 50% before it will start coming down because of the immunity that has been developed, the damage will be too much. So you do these interventions, including lockdown, so that you can lower the peak. So this is what we call flattening the curve, so that the numbers of cases will not go up to the peak.
By way of palliatives, do you think those who give out palliatives should be looking that way without encouraging people to go into self-medication?
Well, thank you very much for bringing that up. It is very important. If you would ask me, the word palliatives should, as used in management of patients, also includes giving out or giving of supportive care, through nutrients. And this is very important. This should be part of it, because as we've discussed, and I'm glad we've discussed the various ways. We look at infecting, allowing the disease to take a natural course, then using vaccination, doing all these things, and with their limitations. However, if you are able to build your own immune system, that is a harder currency, that the value will not drop, and you can withstand and stand and defend yourself against the disease.
Okay. Thank you so much, Dr. John Abide, for your insight. I hope Nigerians have taken note and have taken cognizance of the need to step up their nutrition and boost their immunity against COVID-19. Thank you so much for coming on Health Options.
It's my pleasure. Thank you. And I must applaud the good work that NTA is doing, and people like you who are in the forefront. We continue to pray for you. Thank you.
Thank you.
Yeah.
I wish to once again commend the frontline workers across the country who, on a daily basis, risk everything to ensure we win this fight. For those who got infected in the line of duty, rest assured that government will do all it takes to support you and your families during this exceedingly difficult period. I will also take this opportunity to assure you all that your safety, well-being, and welfare remains paramount to our government. I am using this opportunity to express our deepest condolences to the families of all Nigerians that have lost their loved ones as a result of the COVID-19 pandemic. This is our collective loss, and we share your grief.
That does it on this episode of Health Options. Wash your hands with soap and water or use hand sanitizers. Stay at home, and if you must go out, use a face mask and observe social and physical distancing, in addition to, of course, boosting your immunity based on professional advice. Stay safe and stay healthy. You can go to our YouTube channel for the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi, Abdallah. Thanks for investing your time with us. Hope to see you again.